Hello.
My name is Heidi. I'll be your nurse.
Hi, Heidi.
I'm going to educate you on your diagnosis of cirrhosis of the liver. So we're going to talk about how to manage it at home, like diet, food to like restrict, and ways to take your medicine safely.
Okay.
And to kind of avoid complications with your diagnosis.
Okay.
So here is the paper for your education, and I'm going to go through it with you.
Okay.
So, like here is a food label.
Okay.
You see this line that says sodium right here?
Yes.
This one has 890 milligram in just one serving.
Oh, wow. I didn't realize that was how much salt was in it. Wow. I'm glad you pointed out.
Yes. Since your liver isn't filtering fluids and salt as well, too much sodium can make you swell up or feel short of breath. So we want to like aim to like less than 2,000 milligrams of sodium a day.
Okay, so you mean I should pay attention to my food label?
Yes.
And pay attention to the sodium content in the foods.
Yep.
Okay.
So it would be good if you can aim more for like no salt added or unsalted on the front of the package of your food packages.
Okay.
And if you can try to stay under like about 140 milligram of sodium per serving,
Okay.
it's considered low sodium, so that would be good for you.
Okay.
When you plan your meals, think fresh and simple. Fresh fruits, vegetables, lean meats like chicken or fish, and foods you season yourself with herbs instead of salt. For example, instead of using seasoning salt, try garlic powder or lemon juice.
Okay, that's good. Yeah, I like to eat fish, so I'll try to do that.
Okay.
So, I know you're talking about sodium, but I like I like having snack, throughout the day. So, is there any snack that I should be looking for to reduce my sodium intake?
Good question. You can do like unsalted nuts, fresh fruit, low salt popcorns, or yogurt.
Oh, okay.
And always check those snack labels too, just to see the amount of sodium that will be in it. But yeah, those are good choices.
How about crackers? I like to, snack on crackers throughout the day. Does that have too much sodium, or is that okay?
And those ones kind of have a lot of hidden sodium, so I wouldn't recommend that.
Oh, okay, thank you.
So can you show me on this label where you check the sodium next time you go shopping?
Yes, so if I understand, you saying that if I go shopping, I should pay attention to the food label. So for example, on this packet of crackers, I see the sodium content is very high, and also some canned fruits or some processed food, I see that their sodium level is high. So I should be paying attention. And you said to aim for simple and fresh instead of processed.
Yes,
Okay.
you got it.
Thank you.
Perfect. Now we're going to go over your medications.
Okay.
And we will see, let's go over your medication and what's safe for your liver, because your liver isn't working at full strength.
Okay.
Some medications can be really hard on your liver.
Okay.
We call those hepatotoxic drugs.
Okay.
They can make your liver damage more even if they are over-the-counter medications.
Oh, okay. So what kind of medication are you talking about? Like, am I okay taking Tylenol or?
One of the big ones would be acetaminophen.
Okay.
That's the main ingredient in Tylenol.
Okay.
So if your doctor say it's okay, I think it's written here, right here.
Okay.
So you can take it, but in small amount, but never more than what is prescribed from what the doctor told you there.
Okay, so I should stick with what the doctor said and take
Yes.
exactly and not take too much.
Yep, and avoid anything that will have acetaminophen in them at the same time, because it can add up and hurt your liver.
Okay. I usually take ibuprofen, when I have like muscle pain. So is ibuprofen okay, or does that also have acetaminophen in it?
I would say that one doesn't have acetaminophen in it, but it can cause you bleeding and hurt your stomach,
Okay.
especially with cirrhosis.
Okay.
So it's better to avoid those completely unless your doctor says otherwise. So I would say Advil, Motrin, those are like example of NSAIDs, and you should stay away from it because it can increase bleeding and it's not good.
Oh, okay. So I can't really take. It doesn't look like there's a whole lot I can take for pain, right?
You can, but just safely. I would recommend you to talk with your provider about what's best for you. So maybe, for example, I see the doctor wrote like Tylenol on your list here.
Okay.
So, and it's in very low dose there.
Okay.
So that is good.
Okay.
So those are, so since it's a small amount, it will be easier on your liver.
Okay.
But don't take anything new to add on top of that.
Okay. Okay.
Even herbal or over the counter without checking first. So just stick to what the provider wrote on that list for you.
So what about when I get a cold? I like to take some cold medicine over the counter. Are those okay to take on top of my Tylenol?
I would say before you take anything, double check the label or ask your pharmacist or doctor. That's the safest ways to protect your liver.
Okay. All right.
Just to make sure that I explained that clearly, can you tell me which pain medicine you should stay away from and why? And can you give me an example? Like, for example, I said NSAIDs, you should stay away from your NSAIDs. So can you name some of it that you should stay away from?
I think you said some NSAID that I should stay away from. Advil, Motrin, ibuprofen, Aleve. Is that correct?
Yes, you got it. So let's talk about staying safe at home, because your liver affects how your blood clots. You are at higher risk for bleeding and bruising, even from small bumps. So it's super important to make your home safe as possible.
Okay. So what kinds of things do you think I should change in the house to stay safe or prevent injury?
Well, I will start with your floors. You can keep your walkways clear, pick up throw rugs that might make you trip, and wear shoes with non-slip soles.
Okay.
If you ever feel dizzy, sit down right away.
Okay.
And when shaving or brushing your teeth, use an electric razor and a soft toothbrush to avoid cuts and bleeding gums.
Okay, I didn't know that. Thank you.
So, and on your sheet right here, there is a list of little changes that you can make at home too, like adding grab bars in the bathroom and keeping night lights on.
Okay. Yeah, I kind of bruise easily already, so it's good to know these information.
And also about your bruising, it's common with cirrhosis. So try to avoid bumping into furniture, and don't take aspirin or ibuprofen unless your doctor tells you to, because ibuprofen and aspirin increase bleeding. So
okay, thank you.
Your immune system can also be weaker right now, so you want to protect yourself from infections. Wash your hands often, especially before eating and after using the bathroom. Try to avoid people who are sick and stay up to date on vaccine like the flu shot.
Okay. Sometimes I get a fever, but it just goes away on its own. Should I be worried?
Yes, with cirrhosis, even with a small fever could mean an infection. That needs quick treatment. Call your doctor right away if you notice any of these. Fever above 100.4 degree Fahrenheit, which is 38 degrees Celsius. If you notice like your belly swelling or pain that is worse, call your doctor. Confusion or sleepiness, vomiting blood or black tarry stools, yellowing of your eyes or skin getting worse. Keep this list somewhere
Okay.
visible, like on your fridge, so you can check it anytime you are not